Hello, I'm Duncan and welcome back to Children and Not Small Adults. Today we bring you a special session on COVID-19 because of the ongoing pandemic all over the world and how complicated it's getting. We thought it important to discuss this topic. We will talk about some key facts about COVID-19 that we already know, some key knowledge about symptoms and signs, and we will also talk about, importantly, how to take care of yourself and how to take care of others when they're tested COVID-19 positive. How to protect yourself, and protect others. Who are those at risk? And importantly, what should you not do? And when should you immediately seek for emergency health care? Now, COVID-19 is the name of the disease, and the cause is the coronavirus, or the SARS-CoV-2. Now, what are the symptoms? COVID-19 causes a wide range of symptoms and signs. Under this, the commonest, we talk about fever, we talk about cough, difficulty in breathing or shortness of breath. We talk about fatigue and muscle pains or generalized body pains. New onset of difficulty tasting or difficulty smelling, headache, sore throat, congested nose or running nose, and many others, nausea and diarrhea. It causes severe complications to the lungs, especially causing your brain to not have enough oxygen, causing your respiratory system to fail. But now we know that COVID also affects all the body organs and can cause organ damage and therefore death. What about these mutations? Now, a mutation means that the virus changes its original DNA structure. And with this, it can change how it affects the body, how severe it is, and how quickly it spreads, and who is at highest risk of severe disease. We talk about older people, and as you go above 50, 60, the risk starts to increase more and more. And above 80, 85, it is the highest risk for severe disease and death from COVID-19. Talk about people with chronic illnesses such as asthma and other respiratory or other lung diseases like COPD, interstitial lung disease, cystic fibrosis. We talk about diabetes mellitus, both types, heart disease, those with high blood pressure or hypertension, those with obesity. We talk about people with kidney disease or liver disease. We talk about people with chronic immunocompromised illnesses such as HIV and other immunocompromising diseases like cancer. We talk about sickle cell disease, Down syndrome. All people with these kinds of diseases have a higher risk for severe disease and need to be protected and cared for with extra care. We talk about people who are pregnant or who were recently pregnant, those who are smokers, or those who are taking drugs, other different kinds of drugs, and of course, occupation, those who are working in areas where they interact regularly with people, like in hospitals, in schools, in supermarkets, and other health public places. Now, if you have mild disease without complications, you can receive care or take care of yourself from home. Number one, self-isolate. Protect other people. Number two, hydration. Drink as plenty as possible. Have a bottle of water next to you at all times. Clean, boiled drinking water, fresh juice, whatever you can drink, please drink as much as you can. Number three, you need to get plenty of rest because your body immunity relies on rest. The immunity needs to get stronger to fight this disease. Number four, we talk about vitamin C and zinc. You can take these regularly because they also help to boost your immune system. If you have a high fever, severe body pains, or severe headaches, you can use what we call over-the-counter medications like paracetamol or ibuprofen, but carefully and in the right dosing. Antibiotics do not treat viruses. Antibiotics like azithromycin, like amoxicillin, They are not used to treat viruses, and they will not treat COVID-19. Important is that you take these medications only when they are indicated, only when you have a bacterial infection on top of COVID-19. Do not use steroids. Do not self-prescribe steroids like prednisolone, hydrocortisone. When do you seek emergency medical care? And this is important. Number one, if you notice any trouble breathing, difficulty breathing. Number two, if you have any persistent pain or heaviness in your chest, seek medical care. Number three, if you have start to develop pale or gray or blue color under your lips, tongue, or under your nail beds, immediately seek medical care. If you develop new confusion or any sort of change in your neurological or in your mental status, if you're too weak to move or to eat or too weak to drink, or if you develop other signs and symptoms which are concerning for you, immediately seek medical care. Call the responsible people in your region, in your health region, so that you can receive the advice and the emergency quick healthcare in the hospital. Now, in summary, what have we said? Number one, COVID-19 is the disease, SARS-CoV-2 is the virus. To protect yourself and to protect others, wash your hands and sanitize your hands regularly. Keep a social distance of at least 1 meter, 1.5 meter from the other person. Stay at home if you have symptoms, and get a COVID-19 vaccine at the first opportunity. Those at risk, we talked about older people, 50, 60 and going above, chronic diseases like especially lung diseases like asthma, COPD, people with diabetes mellitus, hypertension, obesity, kidney disease and liver disease, HIV, sickle cell disease, and others. People who are pregnant, people who are smokers, and people whose occupations include daily or regular interaction with other people. Remember, stay safe and take care of yourself, protect yourself, and protect others. COVID-19 is real and it kills. Thank you very much. Join us next week for our special edition of COVID-19 in children. Other than that, please remember to subscribe. We'll see you next week.